Sorry about that. When you work in the emergency department, you get sick a lot, you know? There is a side of healthcare we all don't see, even me, until, well, I saw it. But it wasn't the first time I saw it. I just forgot about it. Well, actually, that's not true. I chose to forget about it, and I have mixed feelings about it. Let me explain. Most weekends I work in the emergency department. The ED is loud, messy, random, chaotic, monitors alarm, ambulances arrive, families ask questions, staff move quickly from one crisis to the next. We stabilize, diagnose, intervene, and then we move on. Emergency medicine and nursing is a profession built around urgency. We spend our days trying to change the trajectory of someone's worst moment, and then they leave, or they get admitted, or they get transferred. They go somewhere else. Every so often, I go to that somewhere else. I spend a weekend teaching nursing students at the long-term acute care facility. It houses both an ICU and a long-term medical surgical unit for patients who are recovering. Some see it as a place to heal. Some see it as a place to find treatment. Others, to die. I originally picked up the assignment because I really enjoy teaching. It also gives me a break from the intensity of the emergency department. At least, that's what I thought. What I didn't realize was that this facility would become one of the most sobering places I'd ever visit. In fact, it's more sobering and amazing and awful all at the same time. The first thing you notice is the quiet, not the peaceful kind of quiet, the kind that settles over a place where life has slowed down. There are no trauma activations, no overhead pages, no sprinting down the hallways, or at least that's the plan. Instead, there is a steady rhythm of ventilators, a soft hiss of oxygen, the occasional cough from behind a closed door, maybe someone yelling. No one probably ever knows why. The sound of a television playing to someone who may or may not be watching. As I walk the halls with students, I find myself reading the stories written in the rooms. I compare them to their charts. I look at their situation. A man who survived a devastating stroke and can no longer speak. A woman attached to a ventilator who now communicates by blinking. A patient with a tracheostomy who has been hospitalized for months, years even. A younger patient whose body survived a catastrophic accident while the rest of his brain didn't. And while the rest of the life he had moved forward without him. Some rooms are filled with visitors, children, spouses, parents. They sit at the bedside holding hands and adjusting blankets, telling stories, hoping for progress. Some cry quietly, some ask questions. No one can truly answer. Some simply sit. Then there are other rooms, the rooms that don't have any visitors at all. No flowers, no balloons, no photographs, no music. No evidence that anyone has been there for days, except the nurse, or the doctor, or in this case, my student. Maybe me. Sometimes I wonder about those patients the most. Who were they before they arrived here? Who misses them? Who remembers the version of them that laughed, worked, traveled, argued, raised children, walked dogs, paid bills, lived ordinary lives? Healthcare has a way of reducing people to diagnoses. Respiratory failure, anoxic brain injury, stroke, traumatic brain injury. I went out for a bike ride or a run, and now I'm paralyzed. Quadriplegic. Every room reminds me that every diagnosis began as a person with plans for the next week, the next day, the next hour. One thing that always stands out is the nursing staff. Many have worked for years, and one nurse I often see use her lunch break to take a nap. Not because she's lazy, not because she's disengaged, but because she is exhausted. She needs a moment. I get that. Like, I really get that. You can't nap in the ER, though. That's not part of the plan. But I'm not saying the nurse napper is wrong. She or he has the kind of exhaustion that comes from spending years caring for patients who may never fully recover. It's almost like the biggest letdown ever. Or is it? But it's the kind of exhaustion that comes from carrying sadness professionally. Like for a job, it is to carry sadness forever and keep coming back to try to make it softer. For yourself some days and for others most days. Every day this nurse returns to work and does it again. Turns patients, administers medications, provides comfort, offers dignity, continues showing up. There is something quietly heroic about that. As emergency clinicians, we often celebrate dramatic, life-saving events. The patient who regains a pulse, the STEMI that makes it to the cath lab, the trauma patient who walks out of the hospital, the valve replacement that crashed 9 times, sipping on pressors and lived. But there is another kind of healthcare heroism that rarely gets recognized. The people who care for patients after the excitement is over. And I don't mean to be insensitive when I say the word excitement. Excitement is a good thing. It's often laced with anxiety and fueled by caffeine, adrenaline, and a solid background laced with incredible medical and nursing skills. Many of those skills, these clinicians didn't learn in school, they were just born with them. If you're one of us, you know, you understand. After the headlines, after the recess, after everyone else has moved on, the people who continue showing up for patients month after month, walking those hallways of this long-term care center, changed the way I thought about the ED, even after all these years. When I'm rushing through a busy shift, it is easy to think only about getting through the next task, the next patient, the next chart, the next ambulance. But now, sometimes I picture where some of those patients may end up. I think about the patient with a devastating stroke who refuses blood pressure medications, the patient who won't wear their seatbelt, refused a life-saving vaccine or procedure, the patient who won't take their diabetes seriously or simply just can't afford it, the patients whose oxygen saturation hovers over 70 because they continue to smoke despite severe lung disease. I think about how a single decision can alter the course of an entire life. And I think about those quiet hallways. Yet they are so loud, they are screaming in my brain. And the ventilators, the family members sitting beside the hospital beds, the empty rooms without visitors. This does not make me judgmental. If anything, it makes me more compassionate. Life is so fragile, so cliche, right? No, it's the truth. The distance between independence and dependence can be remarkably short. Did you know that you can be deconditioned in simply a matter of 48 to 72 hours? It can take you weeks to get back to the way that you were. A distracted driver, a missed medication, a delayed diagnosis, a fall, a bad day, and suddenly everything changes. Those weekends remind me why prevention matters, why education matters, why difficult conversations matter. What every nurse and doctor and healthcare worker does matters. And I'm not talking about just the doctors or just the nurses. I'm talking about everyone, the respiratory therapist, the janitor, the security guard, the psychiatric liaison, the cook in the kitchen, the woman at the front door that answers the bell to let people in the building, the cardiac telemonitor technician. I could go on. Why does every opportunity to help a patient make a healthier choice matter? Not because we can prevent every tragedy, we can't, but because sometimes we can change the ending. The emergency department is where many of these stories begin. The long-term care facility is where some of them continue and some of them die. Seeing both ends of that journey has made me a better clinician. And every time I walk back into the ED after teaching, I carry those hallways with me. and the reminder that behind every emergency is a future we may not yet be able to see. In the emergency department, we often measure success in minutes, possibly seconds, return of spontaneous circulation, or door to blue time, or time to antibiotics, or time to CT. But healing is not measured in minutes. Sometimes it's measured in months and years. Sometimes it's measured by whether someone still has a hand to hold when the room gets quiet. The emergency may last 1 hour. The consequences can last a lifetime. I think about that every time the ambulance door opens, or anytime anybody opens their mouth to talk to me. Because somewhere beyond the noise, beyond the monitors, beyond the conversations, beyond the organized chaos we call emergency medicine, there is another hallway waiting. And one day, it may be waiting for one of us.